So good morning, Ms. Kamai. My name is Anna and I will be your nurse for today. I'd just like to tell you that whatever will be discussed today will be confidential and will only be discussed with the healthcare team if needed, okay?
Okay.
Okay, so we have a couple of minutes to discuss about any of your health concerns. How are you feeling today?
Well, I feel lousy and I don't really feel good about myself right now.
Oh, how so?
Well, I just with the doctor and he was telling me to start exercising to better manage my type 2, my diabetes, but to be honest, I'm so stressed out with work and I don't have time to exercise. I work as an accountant and as you know, it's like a tax season right now, so I'm so way busy. I know I should try it, but it makes me feel dizzy and every time I try to.
Okay, so you're saying that you're fine without the medication and you're managing well. You're also stressed about your work and you can't find the time to exercise. But you still have concerns about your health.
Yes.
So can you tell me more about how you're managing your diabetes?
Well, lately my family and I have been going out to eat and for me I don't have time to cook. And for me eating outside is just quick and on the weekends I try to eat healthier and I always remember to take my insulin before meals.
Okay, so it's good that you still find the time for your medications despite your busy schedule. I understand it's hard finding time to exercise. Can you tell me more about how this affects your life?
Well, I used to exercise a lot before having kids.
Mm-hmm.
Then I had them and I just gained so much weight. Like, look at me right now. I ate everything I saw. Then while I was pregnant, doctor said that I developed gestational diabetes. Then now I'm dealing with type 2 diabetes. Now I think I'm at my lowest. Exercising now makes me feel short of breath and dizzy. I don't like it. Sometimes I think I should go on the treadmill, but my kids just fill up my time every day.
Okay, so I see that you have been struggling with your weight for quite a while now, especially when you developed diabetes during your pregnancy. I appreciate that you're here sharing this with me and that it takes a lot for you to share these. And you said that you feel shortness of breath and dizziness whenever you exercise. Have you considered alternative ways so you don't feel these symptoms often?
Let me think. Yeah, I think I tried taking it slower, not to shock my body too much. For example, I stretch first and walk slowly before running. Sometimes I think it helps.
Okay, so you feel better when you take it slower at the beginning of your workout.
Yeah. But I just don't do exercise often because of other busy things in my life. As I mentioned, my work, family, kids, and yeah.
Okay, I understand it's hard to keep up with maintaining an exercise routine considering your busy schedule. Now, Ms. Kamai, I would just like to know, what do you think would happen to yourself if you don't exercise altogether?
Well, when I think of my aunt, that they had to amputate her leg because she didn't take care of her diabetes. I don't want to happen to me, like, God forbid it. Like, I want to have my 2 legs to be able to see my kids and grow old with them, play with them, do things with them, go on for like adventures. So yeah.
Okay, so you're worried that amputation of your aunt's leg might happen to you as well if you don't exercise. Now, what do you think will be the benefits if you find the time to exercise?
I think I would feel more better about myself physically and mentally. I've been struggling with this for 10 years and I think it's been too long to feeling like this. I think it's time to make a change. I'm just really having trouble finding time to do it.
Okay, so you're saying that it's time to make a change. Are you now considering to find the time to exercise?
Okay, I'm not saying I'm gonna do this tomorrow. But I've been thinking of joining my friend Stacy. She uses stairs like every day. Maybe I should follow her. And let me think. They have also a small gym at my office, so like near my office. Maybe I can use that during lunch for 30 minutes every other day. But maybe. let's see.
Okay, that's really great that you considered it. Now let me ask you, how confident are you right now in finding more time to exercise? 0 being not confident at all, 10 being the most confident that you're going to do this.
I think I'll go with 6.
That sounds like a positive 6. Why a 6 and not a 3?
Well, because I should do this, and once I tell Stacy that I want to join her using the stairs, I bet she'll be happy. It'll be my little motivation. I'll be hard first, but I'll do my best for the next couple of weeks, and I'll see after that. I'm not really 100% yet, but maybe I'll do it when my job at work is lessened.
Okay, really good that you consider this change even though you're busy with your work and your family and your kids. Now, let me just summarize what we have talked about so far. Since you were having concerns about your management with diabetes, especially you're having trouble finding time to exercise. But now you have considered the find the time to exercise within the next couple of weeks by taking the stairs at work and also joining your gym down in your office every other day for 30 minutes. Is that correct?
Yes.
Okay, so we'll leave it at this, and I will follow up appointment in the next couple of weeks to see how you're doing. Is that okay?
Yeah, it's fine.
So thank you so much for coming in today.
Yeah, you're welcome.